Sacroiliac pain, we're going to get into that in detail today, how to treat it. It's pain typically on one side or the other in this area. Sometimes the pain will radiate down to the knee, and there's some other details we'll talk about.
So we're going to show you what is causing this pain to happen in you and some easy fixes to solve it.
And Sam is going to help. What do you say?
His,
you.
His jaw fell off. So we'll show you the typical pain pattern, common causes of this issue, as well as 3 options that'll help you fix this.
All right, so let's look at Sam once and look at the location of the SI joint. So S stands for sacrum, which is this bone. I is ilium, or iliac, which is this bone. So obviously they're symmetrical on both sides, and the joint is right between the two. Now this joint is not a mobile joint if it's healthy. It's pretty fixed, but it can shift. And if we look at this, and if it does shift one way or the other, it can lock up there and cause pain, particularly with movement. Walking and weight bearing is the worst. Now, the location where pain is typically felt, if it's the right SI, you'll probably feel it on the right side of the back. Like I mentioned earlier, it can refer down to the knee, but typically does not go past the knee down into the foot. Then you probably have a low back problem. So it can be a little tricky, but the options that we're going to show how to fix will work very well, and we'll get into that in just a minute. Mike, do you have any additions?
No.
Or subtractions?
No.
All right, we're just going to get into it.
So one of the first common causes of SI joint pain is a sudden jolt going up your leg and into your back. Now what we mean by this is possibly missing a step, getting off a truck bed, somewhere where you have some high impact force and you land forcefully, putting pressure up there, and this can sometimes cause that SI joint to start dysfunctioning.
Another possible cause of getting that SI joint to shift and causing pain is from standing to a sit position, particularly in a chair that has a firm seat pan, and you sit down too fast or you fall down and boom, there we go, we get that shift causing pain. Typically, though, the pain occurs when you're standing, not sitting, but that can be the cause. Mike?
Another common thing for people 50 and older is degenerative joint disease, or DJD. This can affect the SI joint region. It just kind of happens as we age, so that can be a common cause as well.
Right. A lot of people call it arthritis. The first option and this option I've had work very clearly and very well. It either works or it doesn't. You simply take a belt. You can take a belt like this. It's important that you can adjust it infinitely, as the first one, it's only adjustable 6 inches. This one has holes throughout the whole length of it, and you'll see why in a second. Put it around your waist. So here's your ilium. You want to get below those, not above. So we're looking at Sam. Yeah, Mike was just pointing it out. If we go above, we just simply squish soft tissue in above there. We want to get onto these bones. You put it around here and on those bones, and you simply tighten up the belt. And that squeezes and stabilizes the SI joint. Here, let me show on Sam so it's clear. All right, so let's clarify why this actually works. Now, I'd mentioned if you're too high and you tighten the belt, it just goes in here, not being effective. Once we get around the ilium, or the pelvis bones, now watch what happens when we tighten the belt up. It actually squeezes those SI joints and stabilizes it. If it's an unstable SI joint, what will happen if this is the proper thing to do is when you walk or stand, this will take the pain very quickly. If you're at a 9/10 standing or walking, you put the SI joint, the SI belt on, or a belt like this, tighten it up, and you'll feel that pain. It typically doesn't eliminate it, but will drop substantially so you can walk in at least a manageable amount of pain, and then it'll improve with time and some exercises that we'll show some later. So there are SI belts, they call them sacroiliac belts. Mike's going to show a bought one, and there's a number of different varieties. They all work the same fashion.
Yes, this is the Sacroiliac Belt, recommended by Deborah Rixo, who is a SI joint specialist. So this is the belt we happen to have. It's pretty simple to use, just buy the correct size. You simply strap it on with Velcro in the same position Brad mentioned. The only difference with these is you will have 2 little wing straps, and to make it tighter, you simply pull tight and then wrap around whatever feels good for you. It just adds a nice compressive force there, stabilizing that SI joint.
Step number 2, now this is in a situation where the SI joint is stable, but it's simply rotated from that fall or whatever you may have, and it's out of place, and we need to get it back into place where it's going to be pain-free. Now, this is what we're going to show is muscle energy techniques. We're going to show you 3 different options. They're simple, they're quick. If they work well, the pain will reduce while you're doing it as well as after you're done. Let's go right to the exercises. All right, the first muscle energy technique Mike's going to demonstrate. You can do it on your bed or on the floor. It really doesn't matter. Go ahead, Mike.
So what you're going to do is bring one knee up to your chest like this. You're going to clasp just below your knee, and then we're going to actually push like I'm kicking towards the floor like this, but I'm going to hold it for an isometric hold of 5 seconds. Now, if this feels good, this is a good stretch for you to do. Make sure to do it on both sides. How many repetitions should they do of this, Brad?
Well, we're going to do 3 to 5. You're going to try both legs, but probably only one side is going to offer relief, and that's the side you're going to work with, not the other side. And this may not be effective, so we're going to go on another option. Okay, this next technique is similar, but it's different. You're actually going to use a cane or use a stick. We're going to use the Booyah Stik because it's red. It does work better. It needs something a little thicker is better than a cane. But either way, work with something that you have that's strong and long enough.
So what you're going to do is you're going to take one leg, this is going to be the knee up to the chest version again, and you're going to fish the stick between here. So what I'm going to do is I'm going to still push this leg down like we did before, but in order to hold it here, I have to pull this leg up towards me, so you're going opposite directions. You obviously want to hold onto the stick, because otherwise it's going to do this. So hold the stick, push. You're going to hold this for 10 seconds the whole time I'm pulling up and pushing down at the same time, and then relax, and then make sure to reverse the order and try it the other way as well to see which side gives you more relief. Again, I'm going to be pushing down with the left this time and pulling up with the right simultaneously. Hold for 10 seconds and see which feels better.
Right. Again, only treat the side that gives you relief. If both of them hurt, well, then it's not an option. We do have another one. All right, now this technique I learned at a SI joint or sacroiliac joint clinic, and I've had good success with it with patients. However, it has some limitations. First of all, you need a door jamb that's wide enough. Okay, then you need to put a chair in between, and this muscle energy techniques requires a little bit of flexibility. If you're able to do this and you feel safe, it works well. You need to have your shoe on because you're going to put your foot up here. Now you can tell if this is too narrow, it's not going to work if you're a tall person. So you are limited, but if you can get a position like this and it fits, you're going to take this foot, and now this is where the energy comes in. The muscle energy is by pushing your foot that way. That's going to push your back against this side of the door frame, and we're going to push just like Mike talked about for about 5 seconds and then relax. If it feels good, like it's offering relief, you're going to do that 3 times, then relax. You can do the other side as well. Again, probably it's going to work on the painful side, but sometimes SI joints respond strangely, if you will. But again, try the other side. Only work the side that offers relief while you're doing it. And then stand up, put weight on it, walk around, see how it responds. If it responds well in here, as well as with walking and weight bearing, you want to continue to do that 2 to 3 times per day. All right, the third step is a stretch. This is what I personally do. My right SI does irritate me from time to time. I do this while it hurts to get it better, as well as a maintenance stretch in between so I don't have the flare-ups. You simply find a very solid object. This is not solid, so I wouldn't use this, but for display purposes, I'm going to do it because Mike will show it on some stairs that works well and probably the best. But you put your foot up on a solid object about waist height or a little bit lower, depending on what your needs are. You simply lean forward, and we're actually putting a little rotational force on that pelvis and that SI joint. Again, the same rules apply. If you're doing it, if it feels good while you do it, you can hold it for up to 5 seconds, then relax, do it 3 times. Relax and walk around. Again, see how it responds. If it feels good while you're doing it, and afterwards, you want to do that at least 3 or 4 times per day. Mike, you want to show them how to do it on the steps?
Simply hold on to both handles for support. Start on the bottom step to begin with. If this feels okay and you feel steady, you can certainly lift your leg up higher. You're going to get a little more range of motion in that hip and the SI joint moving. So just do what Brad kind of said. Hold it for 5 seconds. Do 3 to 5 repetitions if it feels good.
Okay, now this last treatment is not an exercise. It's easy to do. It feels good and it works quite well. I use this on a regular basis for maintenance as well as when my SI is flared up. And it's a massage gun. That's the down point of it. You have to have a massage gun, and you need a massage gun that has air head. That's this, and it's actually soft because it's a little bony around that SI joint. If you use a harder head on one of these massage guns, it's not going to feel good and it's not going to work. So massage gun with an air head, if you have it, you're in luck. I would suggest doing it. Put it on a low setting. Like this has 5 settings, so does that one. I'm going to start low. Mike?
I'll get out of the way.
Well, Mike has the round head. You could use that on the muscular hip area. I would just go right with the air head. Then this is exactly how I do it. I lie on my side. I bring my sore hip or SI joint forward like this, and that's the area. I'm going to start in the muscle area, and I'm going to work up in this area, and you simply go by what feels good. When you massage with these, if it hurts, you're not either going too aggressive or you're in the wrong location. If you happen to have a knot and you go over it and it hurts, simply go around that knot. Relax, relax, breathe, and then eventually you can get on that knot. And that might be the problem right there. You have a real tight muscle pulling things out of place. Once you get that muscle to relax, the pain goes away with it. It's a big advantage of the massage gun. And I will actually, with this airhead, go right over the top of the SI joint. There is not much muscle, if any, there. There's just soft tissue depending on your body type. And again, it feels good. If it hurts, you're doing it too hard or in the wrong location. Just another option. This is our new Air 2. It actually is nice. You can hold on to it gently. Mike has the
Q2.
Q2. That's one of our. That's been around for a long time. So, anyways, good luck with your massage. Now, we do have another video that actually goes from Deb Rixo, which you mentioned already. She is an expert. If none of these work, get her book or watch some of her videos. We have videos of her, and it's it's more information that you may want to know, but it will get to the bottom of it. All right, try these options. If by chance it's a stubborn SI problem, Mike's got an option.
You can check out Deborah Rixo's book. We will link it down below. And we've also interviewed her a couple times on our podcast channel. So if you'd like to check out either of those videos, she goes in great detail of SI joint dysfunction and how to treat it.
That's right. She's an expert.
Bob and Brad, the 2 most famous physical therapists on the internet.